So during your Nclex exam, there are high chances that you are going to get a question about sign and symptoms of right side heart failure versus left side heart failure, right? So in this video, I will try to explain you in simple word what is the sign and symptoms of right side heart failure versus left side heart failure. At the end of this video, we're gonna do 8 to 10 practice question, and you will see how easy it is going to be for you to solve all of your question and answer. Not only here, but during your Nclex exam, it's gonna be super easy peasy lemon squeezy for you to solve all of your answer when they ask you what is the symptoms of right side heart failure versus left side heart failure, right? So let's discuss about right side heart failure. So I will try to explain you in simple word what is the meaning of right side heart failure, right? So in right side heart failure, what happened? The right ventricle of the heart cannot contract with enough force to push your deoxygenated blood out of your heart, right, into pulmonary arteries to your lungs for oxygenation. That is happening in the right side heart failure, right? So if I have to explain you in another way, so that's mean if your deoxygenated blood which is coming from your upper extremity and your lower extremity, right, because of right ventricle is failed, so the blood instead of going out of your heart is pushing backwards, like is pushing backward. So when all your blood is returning is pushing backward, what's gonna happen next? So because of high pressure, the blood will go backwards and it will start leaking in your abdominal area. It will start leaking in your liver area, so your liver is gonna be bigger size. That's what we call hepatomegaly. That is the famous word for Nclex. They might ask you like that, hepatomegaly. So the blood will leak in your abdominal area, also will cause ascites. It will leak in your liver area, which will call hematomegaly, and it will also leak in your lower extremity, which we call edema, peripheral edema. So these are the things happening in your right side heart failure, right? Now I'm gonna discuss about left side heart failure. So what is happening in the left side heart failure? So left side heart failure means the left ventricle of the heart cannot contract with enough force to push your oxygenated blood to your body, right? Oxygenated blood to your body. So when it happen, the blood will back up. Also in this situation, the blood will back up and it will go around your lung area. So that's what we call pulmonary edema will happen over there, right? That is happening in the left side heart failure. Got it? So right side heart failure means the right ventricle fail to push your blood, and the left ventricle fail to push your oxygenated blood to your body, right? That is happening in the left side heart failure. So in the left side heart failure, you just have to remember all the sign and symptom is going to be related to breathing or lung. Whatever is around breathing or lung, you have to select that. And on the right side of the heart failure, whatever is a systemic circulation, you have to select all the sign and symptom from there. So left means left lung, left side heart failure, left lung, which means all the issue about breathing, all the issues about breathing and lungs, and the right side everything about rest of the breathing issues, right? And right side of heart failure, you just have to remember sign and symptoms of rest, circulation, right? So let's discuss about sign and symptom of both side. So right side heart failure, there are two mnemonics that I am going to share with you, and the left side of the heart failure also I'm going to show you two mnemonics. So once you know these two mnemonics, it's going to be very simple for you to solve all of your practice question when we will go over it, right? So first mnemonic for the right side heart failure is called swelling. So the first mnemonic is swelling, right? So swelling means you will see swelling in the legs, you will see swelling in the feet, and you will see swelling in the abdominal area, right? Because all your blood is pushing backward, right? So it's going backward in your circulation, it's going in your, as I mentioned, it's going in your abdomen, it's going in your lower extremity, and also it's going into your liver, which we'll call hematomegaly. So as for that, right, because of too much fluid in the body, you will see weight gain, right? That is the second thing. And also third thing, you're gonna see edema, which will be pitting edema, right? And the next thing, you will see large neck vein. Large neck means because too much pressure there, so your jugular vein will be distended. Just remember that JVD, also known as jugular vein, will be distended, right? Also, you will see lethargy. Patient is going to be very lethargic. You will see irregular heartbeat, and patient is going towards AFib, right? N4, the patient will be very nauseated. Because of too much fluid, the patient may don't want to eat something. So anorexia is another problem, right? And the girth of abdominal, because too much fluid also leaking in your abdominal, so girth of abdominal is going to be increased. So that's the sign and symptom of right side heart failure, known as swelling. Another mnemonic which is pretty similar is called O-head. O-head, right? A for anorexia or nauseated, the patient is going to be anorexia or nauseated. W for weight gain. H for hepatomegaly, very famous word. Hepatomegaly means enlarged liver. E for edema. A for ascites. So when fluid start leaking in your abdominal area, is called ascites, right? Ascites. And D for, again as I mentioned, dilated vein, dilated jugular vein. So that's the sign and symptoms of right side heart failure, right? So now let's discuss about left side heart failure sign and symptoms. So in this one, the mnemonic you need to know, there are two mnemonics. The first mnemonic is drowning. Let's start with drowning, right? So drowning means the D is gonna be difficulty in the breathing. As I mentioned, the left side heart failure is all about breathing and lung issue, right? All about breathing and lung issue. So drowning, that's the mnemonic. So D means difficulty breathing, right? R for because too much fluid in the lung area, so you will hear rales and crackles, right? O for orthopnea. So when patient is sleeping in the supine position during the night, he gonna have shortness of breath. So the best position for this patient is, tell the patient to put 2-3 pillow and sleep like this. Sleep like this. Put 2-3 pillow and sleep like this, like in sitting position. That's orthopnea. Also, you will see patient will be weak. So weakness is the next thing. Nocturnal paroxysmal dyspnea. So during the night time, patient will have shortness of breath as well. Because the left ventricle is trying to push blood, so your heart is working faster, right? Heart is working faster. That means you will see patient with tachycardia, fast heartbeat, sinus tachycardia. Another thing, you will see nagging cough. Nagging cough means when the patient will produce pink sputy or bloody sputum. Pink, fruity or bloody sputum. And also patient will have weight gain. That's the drowning. The another mnemonic for drowning is do chap. Is pretty similar, also related to breathing and lung issue. So D for dyspnea, difficulty of breathing, right? O for orthopnea, when the patient is sleeping in supine position during the night, he is having shortness of breath. And C for cough, you will see cough. Hemoptysis, pink fruity blood ting sputum the patient will produce. And adventitious breath sound, which means you will hear crackles, rales in your when you hear with the stethoscope, right? And lastly, P for pulmonary congestion. That's the sign and symptoms of left side heart failure. So that's the wrap up of your right side versus left side heart failure. So now we will do practice question and answer, and you will see. You just have to remember left side heart failure, whatever the question they will give you, you just have to give all your answer through breathing issue or your lung issue, like crackles or difficulty breathing, shortness of breath. You have to select that. On the right side, whatever other thing they will give you, like peripheral edema or like the one we discussed about sign and symptom, you just have to select that one, right? So let's practice question and answer, right? So let's do 7 practice question and you will see how easy it is going to be for you to solve it. Let's do right side heart failure first, right? So first question on the screen, a nurse is assessing a client with right side heart failure. Which finding should the nurse expect? So what I mentioned, the right side means right right ventricle fail to pump blood effectively, right? So when it happens, all the blood goes backward and is going to your systemic circulation. So what would be the sign and symptom in this one? Pulmonary. So as I mentioned, the left side will be all the breathing issues because of lung, all the breathing issues, including shortness of breath, rales, crackle, all of this thing, right? Left side for lungs, right side for everything else. So let's say a nurse is assessing a client with right side heart failure, right? So this is right side heart failure. Which finding should the nurse expect? Pulmonary crackles? No, because that's for the left side. Anything breathing or crackle, left side. Pink fruit is sputum? No, also left side, right? Based on our uh, mnemonic, right? Increase abdominal girth and orthopnea. Orthopnea also breathing issue, so that is moved to left side. Increase abdominal girth, yes, that is your answer. As I mentioned, the blood is going backwards, so it is going to your abdominal area, lower extremity, your liver area, so that is called increase abdominal girth. That is your first answer. See, easy, right? Now move on to next question. A client is diagnosed with right side heart failure. Which assessment finding will nurse expect the client to have? Select all that apply. Peripheral edema, yes. Crackle in both lungs, no, that is for left side, right? Increase abdominal girth, yes. Ascites, yes. Ascites means when the fluid accumulate in your abdominal area. Nausea, yes, the patient will also have nauseated. So your answer are peripheral edema, increased abdominal girth, ascites, and nausea. Which of the following signs and symptoms, although not present in Howard initial examination, are also associated with right side heart failure? Select all that apply. So right side heart failure, again symptoms are jugular vein distension, yes, JVT. Orthopnea, no, all the breathing issue on left side. Hepatomegaly, hepato means the liver is going to be bigger in size, yes, right, because all fluid backing up in your right, so it's going your abdomen, liver, and your lower extremity. So jugular vein distension, hepatomegaly, yes. Crackle in the lungs, no, right, it's a breathing issue. All the L for left side, L for lungs, right, all the lung issue on the left side. Pulmonary edema, no, pulmonary means lung, right? So when all your fluid backing up in your lungs, that's called pulmonary edema. So at this time our answer are jugular vein and hepatomegaly. Those are the two answers. Next question. A patient has been diagnosed with right side heart failure. The nurse expect the patient to exhibit which symptoms? Select all the apply. So right side heart failure, again, what are the symptoms? Ascites, yes. Orthopnea, no, because that's for left side. Weight loss, no, because all your body patient will have edema and weight gain. So that is your, so for right now we have ascites. Pulmonary edema, no, because that's for lung side, right? Lower extremity edema, yes. So your answer are ascites and lower extremity edema, those two only. The patient is experiencing right side heart failure. Which symptom should the nurse anticipate? Peripheral edema, yes. Crackle in the lungs, no, because that's for lung side. Dyspnea, difficulty in breathing, all the breathing issues and crackles on your left lung side. Orthopnea, difficulty in breathing, left side. So all your correct answer is peripheral edema. What is a clinical manifestation of right side heart failure? Wheezing, no, that is your all your lungs area, right? So wheezing, no. Vasospasm, no. Peripheral edema, yes. Tingling in the extremity, no. So answer is peripheral edema, right? Because the fluid is going to your lower extremity, that's called peripheral edema. A patient with right side heart failure is being treated. Which should the nurse expect if the patient is responding to the therapy? Bradycardia occur, no. Tachycardia occur, right? Diminished pulses, that's for left side. Hypotension, no. Jugular vein distension and edema resolve, yes. So if jugular vein distension and edema resolve, that's called the therapy is working, right? Which should the nurse expect if the patient is responding to the therapy? So that means JVD and edema is resolving, right? Which are the clinical manifestation of the right side heart failure? Select all that apply. Ascites, yes. Hepatomegaly, yes. Generalized edema, yes. Those three. Dyspnea is a breathing issue, is on the left side, and weak pulses is also on the left side. So those are the practice question for right side heart failure, right? Let's do left side heart failure next. A nurse is assessing a client who has left-sided heart failure with diminished cardiac output. Which of the following findings should the nurse expect? So left side, what we're gonna see? All the breathing issues and lung issue, right? So answer is, so what is the breathing issue in this one? So answer C, breathlessness when carrying an object is your right answer. As I mentioned, breathing issue you have to select, right? Which clinical manifestation should the nurse anticipate when providing care to a client who is diagnosed with left side heart failure? Select all that apply. So dyspnea, yes, right. Hepatomegaly, no, because that is for right side. Fatigue, yes. Ascites, no. Crackle noted on lung auscultation, yes. So those are your answers. Hepatomegaly and ascites is gonna be for the right side of the heart failure, right? The nurse is assessing a patient who is suspected to have left side heart failure. Which assessment provides specific information regarding the left side heart failure? So as I mentioned, breathing and all the lung issues supposed to be for the left side heart failure, right? So the correct answer would be auscultating lung sound. Monitoring for hepatomegaly is for right side. Peripheral edema for right side. Assessing for jugular vein distension also for the right side. So your correct answer is answer A. Lung issue or breathing issue always for the left side heart failure, right? The nurse is caring for a client who with left side heart failure. Which assessment finding does the nurse anticipate for this client? So you will see dyspnea, yes. You will see weak peripheral pulses, yes, you will see, and you will see crackle or wheezing in the lungs. So those three answers you will see. The right side you will see enlarged spleen, dependent edema, and jugular vein distension, right? So the left side you will see dyspnea. 156 is your final answer.